Why is back pain so hard to get rid of? You apply ointments, try not to strain yourself, and yet your back still hurts just as much. Maybe you're doing something wrong, the wrong massage or medication. Have you ever thought that your back pain might be caused by your own mistakes? Maybe you're walking when you should be resting, or the opposite. Now imagine waking up just a week from now without back pain, and your lower back doesn't seize up when you bend over or get up from a chair. Sounds nice? Then let's find out what you need to do to get there. In this video, we'll share traditional and alternative methods for treating back pain and reveal little-known facts about spinal health. And our channel's expert and experienced doctor will explain how to relieve back pain without medication and name a super remedy for home treatment. Today, you will learn how to relieve back pain, why walking a lot in old age can be dangerous, why do the Chinese hit themselves on the back, what 10-second exercise puts your spine back in order, which back ointment actually punches holes in your stomach lining, how can you restore youth to your spine and live pain-free again? Where and how should you press to relieve lower back pain? Does moving through pain heal or harm? Which back treatment method is dangerous? And which Chinese technique eliminates back pain for good? Back pain should never be ignored, doctors say, and it doesn't matter whether it's a dull ache, a sharp stab, or a constant nagging. The foundations of a healthy back are the same: appropriate physical activity and a proper diet. But the treatment details vary. That's what we'll sort out today. By the end of this video, you'll have a whole arsenal of tools to fight back pain. Let's start with some information that may completely change your view on anti-inflammatory and pain-relieving drugs, the ones you take by mouth or apply as ointments to soothe back pain. Look, we tend to think that ointments are safer than pills because pills have more side effects. I personally was convinced that anti-inflammatory pills damage the stomach lining, but ointments don't, since we don't ingest them. But listen to what our expert says. Today we are joined by Dr. Pavel Ildarovich Jakupeyev, a neurologist, vertebrologist, and cephalologist. To clarify, a vertebrologist diagnoses and treats spinal conditions, and a cephalologist deals with various types of headaches. The thing is, these ointments can be applied in very different ways. Some people use just a pea-sized amount, while others cover half a palm with the ointment. Everyone also has different skin thickness, so it's unclear how much of the ointment actually gets absorbed into the body, unlike tablets, which have precise dosages. As a result, if enough ointment is absorbed, you'll get the therapeutic effect, but also the side effects. If only a small amount is absorbed, you may not get any benefit, but side effects may still occur. No matter the form, ointment or tablet, anti-inflammatory substances can harm the stomach by reducing the production of protective mucus, which shields the stomach lining from acid. That's why I'd recommend taking a pill instead of using ointment. Dr. Jakupeyev will be revealing even more secrets today, so watch until the end. But right now, let's figure out what exactly is hurting in your back. There aren't many options: muscles, spinal joints, or nerves. If the pain is strictly in your back and comes on during physical activity or after long periods of sitting, you likely have age-related spondyloarthrosis. There's a problem with the joints of the spine, and it occurs to some extent in nearly all elderly people. This pain is associated with aging, but the process is different for everyone. For some, it progresses faster. for others, slower. Some people feel pain while others don't. And when there is pain, it's strictly at the site of the affected joint. If the pain radiates into the leg, arm, or ribs, it's most likely a herniated disc or nerve damage. Sometimes an MRI is the only way to determine the exact cause. But here's something interesting. Sometimes the spine surprises us. The MRI looks perfect, but the pain is unbearable, especially when getting up from a chair or sitting down. So where is the pain coming from? Let's hear from the expert. The lower part of the lower back houses the sacrum. In 80% of cases, pain in this area occurs in women, and diagnosis is typically made during a physical exam by a doctor because we use standardized neuroorthopedic tests to differentiate the diagnosis. CT scans, X-rays, and MRIs can also be used, but they are less informative, and they mainly show arthritic changes, which are not always clinically relevant to pain symptoms. What these scans can reveal is sacroiliitis, or inflammation of the sacroiliac joint. In such cases, we determine the cause of the inflammation and usually treat it with injections, so-called nerve blocks. And there you have it, the answer to why back pain is so difficult to treat. It's because all joints, including spinal joints, don't have their own blood supply. They receive nutrients from the surrounding tissues. Science has shown that in older adults, the intervertebral discs suffer from a lack of nutrients. That's why all spinal recovery techniques and strategies to restore spinal youth are focused on improving blood flow and metabolism. But how do we do that? First, adjust your diet so that your food supports the health of bones and cartilage. We've created a guide on this. Second, add physical activity, but in moderation. We'll soon show you simple exercises that can ease pain without harming the spine. But for now, let's get back to the sources of pain. The most common cause is muscle overstrain from poor posture, prolonged sitting, physical exertion, or stress. Yes, even stress can cause back pain, as strange as it sounds. If you sit in one position for too long or suddenly lift something heavy, your muscles tighten. They become stiff and painful. Doctors and massage therapists call these trigger points. We'll call them pain points, like tiny buttons. Press one and it hurts. If pain points form in your lower back muscles, it becomes harder to bend or turn. You end up compensating with other muscles, like those in your hips or neck. This added strain creates new pain points in other areas. You fall into the pain cycle. Everything starts to hurt, everywhere. That's no way to live, right? So right now, our expert will explain how to find those pain points and release muscle tension on your own. Muscle tightness occurs at what are called trigger points, areas where the muscle may be tense or hardened and painful. The simplest way to relieve this tension is to lie on an acupressure mat. It distracts the nervous system and causes the muscles to relax a little. But that's only a temporary solution for quick relief. If you're experiencing frequent tension, be sure to see a doctor, as the root cause may be joint inflammation or a herniated disc. Okay, we've covered muscle pain caused by overstrain with the help of our expert. By the way, what do you think of our expert? If you like them, give this video a thumbs up. And tell us in the comments what kind of specialists you'd like to see on our channel, and which health concerns or conditions worry you most. And if you want to learn how to treat your specific problem, subscribe to our channel and turn on notifications. Just click the bell and select all. Now let's figure out how to relieve stress-induced back pain. I was surprised to learn that stress affects not only our nerves, but also our muscles. It turns out when we're under stress, our muscles automatically contract, especially in the neck and back, and this causes pain. Experts recommend one simple and effective spine stretch called the cat-cow exercise. Gently arch your back upward like a cat, then drop it downward like a cow, letting the spine curve naturally. Another exercise is called child's pose, and it's great for back relaxation too. Here's how. Sit on your knees. As you exhale, slowly lower your body forward as far as you can. Stretch your arms out in front of you and try to reach as far as possible, lengthening your entire back. You'll feel your spine stretch. Here's another exercise often recommended for side stretching and spinal flexibility: lying twists. Lie on your back and stretch your arms in one direction and your legs in the opposite direction, twisting your body gently. This exercise is believed to improve mobility in the lower back and provide a great muscle stretch. However, it's not the easiest move, and in fact, exercises like this and other stretches are not recommended if you have problems with the joints of the spine. Here's why. Spinal joint problems are referred to as either facet syndrome when it's an acute issue, or spondyloarthrosis when it's an age-related degeneration. In both cases, stretching the lower back or neck can do more harm than good. Those areas provide structural support, so they need to be strong and stable. If you stretch the muscles, ligaments, and tendons too much, you can increase joint instability and worsen spondyloarthrosis. This disrupts joint mechanics and leads to more pain. Instead of stretching, you should focus on building and strengthening the muscles of the lower back and neck. Moderate strength exercises like squats, glute bridges, side planks, and core workouts are best, but only do the ones that don't cause pain or overload. Here's the thing: if the pain is muscle or stress-related, stretching is great. But if it's due to age-related changes in the joints, then it's better to focus on strengthening and stabilizing muscles, and that can actually relieve pain. There's a reason the term muscle corset exists. It supports your spine and protects it from misalignment or injury under load. And here's one great exercise for your muscle corset. It takes only 20 seconds. Just 20 seconds for a healthy back? Come on. But this exercise has been proven effective. The knee-supported plank. It strengthens not only your back, but also your abdominal muscles and shoulder girdle. The key is proper form. Interestingly, while it used to be thought that the longer you hold a plank, the better, recent research shows that 15 to 30 seconds is enough. Beyond that, muscles start to disengage, and you're only training your willpower, not your body. So how do you do the planks correctly? If your knees are sensitive, place something soft underneath them. Make sure your back stays straight. Don't lift your hips too high or let them sag. Imagine yourself as a straight board. Can you hold that for just 1 second? Great. Tomorrow you'll do 2, and in a week, the full 20. The knee-supported plank is suitable for almost everyone. Maintaining general energy and physical activity in your silver years is incredibly important, but spinal health requires specific exercises. Another exercise recommended by our expert, especially for older women, is the glute bridge. As we age, the gluteal muscles weaken, which causes instability in the lower back. This exercise helps stabilize those muscles effectively. Lie on your back, press your shoulder blades into the floor, and bend your knees. Raise your hips off the floor into a bridge position, keeping your shoulder blades grounded. Your lower back should stay straight. Do you think this exercise is safe to do if you have lower back pain or discomfort in another part of your back? Write yes or no in the comments. Our expert has the correct answer. Exercises should feel comfortable. Only mild soreness is acceptable. If you feel moderate to severe pain while doing the exercise, stop immediately. Consult a rehabilitation specialist to find a better alternative. Soreness that appears 1 to 2 days after exercise is normal, but it should be tolerable. Let's repeat this. Never exercise through pain. That rule applies especially during flare-ups. If you're in acute pain, avoid any serious physical exertion until things ease up. So how can you relieve acute pain here and now? This is a difficult question because it's often hard to manage without pills or injections. Acute pain means the pain receptors are severely irritated, and folk remedies rarely help in these cases. The standard treatment is non-steroidal anti-inflammatory drugs, NSAIDs, but it's essential to consider other health conditions like high blood pressure, diabetes, or kidney disease. Doctors may also perform injections, nerve blocks, which are very effective for facet syndrome, but less so for herniated discs. The simplest option is rest. When the body is still, the pain often subsides, though this rest period can last up to 2 weeks. As a folk remedy, warming ointments may help if the pain is muscular. They increase blood flow and relax the muscles. However, if the pain is severe, warming ointments can make it worse. So if there's pain, should we completely avoid movement? Does rest mean just lying down and doing nothing? If even the slightest movement causes pain, then yes, it's probably best to rest. But don't treat yourself like fragile glass. If you can walk, walk. That's the minimum level of activity that helps you recover. Walking improves blood circulation in the lower back, and healing depends greatly on circulation. The more you walk, up to the point just before the pain worsens, the faster the recovery. Here's the interesting thing. We're back to the topic of circulation and the importance of movement. By the way, we'll soon be releasing a video on how to improve blood flow if you have thick blood. Don't miss it. In our previous video about joint health, we explained that synovial fluid, which keeps your joints functioning smoothly, is only produced when we move. As for the spine, walking helps improve the lumbar region, and for that, walking 30 minutes twice a day is sufficient. Just keep in mind, walk without pain, but at a brisk pace. A slow, leisurely stroll may feel nice, but it's not beneficial for your back. You need to walk as if you're running late for something. Sweating or getting short of breath is totally fine. As for the number of steps, everyone's ideal number is different. How do you find yours? The ideal number of steps is different for everyone. The famous 10,000 steps per day? That's a myth. What matters more is the duration and intensity of walking. You should walk briskly, ideally twice a day for 30 minutes. That's the ideal, but you need to find your own norm. If your back starts hurting after a certain distance, don't walk beyond that. Gradually, you'll be able to walk farther and longer. Just don't push yourself too hard. Now that we've covered walking, would you like to know how to practice Chinese medicine for spinal health without harming yourself? Then keep watching this video. You'll discover Chinese secrets to keeping your spine young. The Chinese pay special attention to spinal health. That's why so many elderly people in China stay physically active and don't suffer from back pain. Want the same? In China, people believe in energy meridians. They say back pain is caused by a blockage of ki energy. Imagine that your body has energy highways. If those highways are blocked, energy stagnates, just like water left too long in a bottle. it starts to go bad. That energy stagnation leads to pain. One of those meridians, the bladder meridian, runs along the entire spine and is directly linked to back health. Stagnation in any part of it causes pain. So how do the Chinese relieve back pain? Through an ancient technique called patting. In China, it's common to see elderly people lightly patting different parts of their body during morning exercise. A Chinese healer explained that patting improves blood circulation and relieves muscle tension. This technique is widely used by older people in China to maintain back health and more. You can start anywhere on your body. Gently and painlessly pat yourself, moving from your feet and hands toward the center of the body. Reach behind and lightly tap your back using the backs of your hands. Be sure to pat your feet, calves, knees, and even clap your hands. Give yourself a round of applause for caring about your health. The Chinese typically do at least 500 pats during a session, but you don't have to do that many. Stick to a rhythm. Listen to your body. If you're tired, stop. Does it actually work? What do you think? Let us know in the comments right now, while we take a look at what evidence-based medicine says about Chinese practices. In general, any manual stimulation improves local blood flow in the skin and muscles, which helps speed up healing. As many people know, circulation worsens with age. That's why patting the back, like we see in Chinese practices, has a similar effect to warming ointments or acupressure mats. These areas are often trigger points, as mentioned earlier. I recommend finding such points on your body and massaging them gently. Don't worry if you feel slight pain at first. It'll go away. As for so-called energy meridian points, I don't believe in them. Massaging your earlobes to relieve back pain, for example, is ineffective and not worth your time. And now, folk remedies. Folk medicine offers many effective ways to ease back pain. Here's one that's been known since Soviet times, the mustard bath. Dissolve a cup of mustard powder in warm water, stirring until it reaches the consistency of liquid sour cream. No lumps. Pour the mixture into a bathtub and stir well. Soak for 15 minutes. After the bath, rinse off the mustard, dry off completely, put on woolen underwear and socks, and lie under a blanket. However, not everyone can use warming methods like this on a sore back. Listen to our expert to make sure you don't make things worse. You can take baths, with or without mustard, but if you suffer from joint pain in the lower back, which is common in older adults, do so only during remission, when there's mild background discomfort, rather than a flare-up. Heating the joints improves local blood flow. You'll get the same effect from ointments with menthol, capsaicin, bee venom, or snake venom. Essentially, anything that irritates the skin to enhance circulation. An experienced doctor won't give you bad advice. Often, they can identify the cause of your issue with 80 to 90% accuracy just by observing how you walk, move, stand, and your age. But finding such a specialist is not easy. Fortunately, the expert on our channel is one of those doctors. And today he'll share the one question that separates a seasoned professional from an inexperienced one. What's the one thing a doctor absolutely must ask you? Find out at the end of this video. Now, let me show you how to make an herbal infusion for a youthful spine. Take half a cup each of dried strawberries, birch buds, St. John's wort, immortelle, and chamomile. Mix everything and pour in 2 liters of cool, boiled water. Let it infuse for 2 weeks, then drink 3 times a day before meals. However, this elixir may not be enough in serious medical cases. If your back pain continues or worsens, we recommend seeing a doctor for diagnosis and treatment. But how do you know you can trust this doctor and your spine and your mobility to them? Our expert shares some excellent advice. A doctor's consultation is a complex process. They must collect a medical history, perform a detailed neuro-orthopedic exam, and have skills in neurology and orthopedics. They must also carefully review all test results, typically MRI, CT, and occasionally X-rays with functional tests. Blood work and C-reactive protein levels may also be helpful. We, as therapeutic specialists, view the patient holistically, so it's important to share all chronic health conditions. If you've lost interest in former hobbies or feel apathy, tell your doctor. These could be signs of depression, which both causes and worsens back pain. Also pay attention to the treatments your doctor suggests. If they recommend things like hammer blows to the spine or leeches, consider whether this is someone you can trust. Some may even suggest outdated treatments like IV drips, though modern tablets often have better bioavailability and are more targeted, making them the preferred option. Now, as promised, here's a Chinese secret for treating back pain without leaving your chair. While sitting, squeeze and release your glute muscles. Do this 10 to 15 times. You can also lift your heels and toes alternately off the floor. Rocking from toe to heel like this, the heel pump, stimulates blood flow. If you sit for long periods and can't get up, this will help your back. In closing, let me remind you of this phrase: let it begin with the first step. Your path to a healthy, youthful spine literally begins with a step. So walk, move, hit your step goal if you want to relieve back pain and slow the aging of your spine. Because if your spine starts bothering you as you age, it's not just about aging. It's about how well you take care of yourself. That's all for today. Wishing you health and longevity. Subscribe to our channel, turn on all notifications, and of course, give this video a like. We made it for you. And don't forget the downloadable guide and our helpful tips that support your health.